This community deserves excellent care, and working with consultants to shore up our financial foundation allows that to happen.
We have about 160 coworkers that are from Washington County. If we fail as a hospital as the third largest employer, so does the community fail. So they not only want us to survive because of healthcare, but also about the stewardship of a community.
The early Delta assessments really pulled us together as team members. They came in with just a wealth of resources and consultants that see rural hospitals all across the nation. So that was really key for us to be able to start focusing in on some of our performance metrics and adapt so that we can improve upon those in the future.
Some of the wins that we saw through the DRCHSD program included things like lowering our days in accounts receivable, increasing our cash collected at time of service.
That was one of the huge impacts for quality, for patient care, and for stewardship of the hospital, because bad debt wasn't being incurred, and using experts to help us on the way, such as with the stewardship and financial element with our revenue cycle team, with our CFO, guiding us there to be financially strong for our community. Because if we're not strong, we won't be here for years out.
One of the biggest benefits that we saw from an increase in both cash flow and in prioritizing where our dollars were going was that we were able to invest in things that brought clinical excellence to this community, that raised the bar for the care we were able to provide.
It is a phenomenal resource. It has resources available that can help you with your revenue cycle management, help you with financial stability and realizing what patients would bring the most income or where are we losing money as a company, and things we can capitalize on to propel the clinic to a new level. We started from ground zero. Now we're here.
Since the start of this fiscal year in January, every month has been a new record-breaking month for Savoy Medical. Across the board in our net patient revenues, we are ahead of last year, month for month, across every category and every measurable stat in the hospital. I think that is a direct reflection of not only us being better and having a little more bench strength through our education and training with the partners in the Delta Project, but also through our partners in the Delta Project developing a better name and giving more confidence to the people in this community for the type of health care they receive at our hospital.
So just looking at our payroll and at our bottom line, you can tell how much we've grown.
We are able to do more training, more education. We are able to invest in more staff as we grow our services. We're able to invest in additional equipment that we otherwise never would have been able to afford. So our desire to be financially sustainable isn't pursuing the almighty dollar for the sake of the almighty dollar. It's translating cash into care.
They help put us on this path. We are now sustainable.
Anybody that's in healthcare knows that it's ever changing and there's always something new on the horizon that you need to change and adapt for. So the Delta program helped us grow financially to be more sustainable in those areas so that we can adapt in the future.
We feel we're on firm financial footing to meet the needs of this community going forward. We've gone from a Band-Aid station to a full-fledged hospital and a robust rural health clinic that has 8 different specialty cares to meet the needs of our patients. So we have changed so dynamically from when we first started. It's really hard to not just smile about it. It's just really awesome.